Well, it's time for a gut check. We are taking a look at the second leading cause of cancer deaths in the U.S., colon cancer. As KPTV's Kimberly Moss reports, this is actually one of the easiest kinds of cancers to treat and prevent, but you have to get screened.
A colonoscopy is the most common and effective screening method for colon cancer. But let's face it, no one particularly likes thinking about the polyps that may lie in your intestines. This is where Polyp Man comes in.
You know what a polyp looks like.
Dr. Tony Simmons is a colorectal surgeon at PeaceHealth St. John Medical Center in Longview. Willing to get silly if it will help convince others to get screened for colon cancer. The 50-year-old surgeon also willing to let us record his first colonoscopy.
It's probably the most preventable cancer that there is.
Completely normal. Looks just fine.
PeaceHealth gastroenterologist Gordon Matlock performs the colonoscopy. Roughly half of all Americans who should be tested never get this screening. It takes years for polyps to grow and become cancerous.
And often, by the time you're symptomatic, it can be fairly far advanced.
That's why if you catch polyps early and remove them, they can't hurt you.
You take out a polyp and at least you theoretically prevent cancer.
Patients can be partially or totally sedated during a colonoscopy and literally not feel a thing, but there is that preparation the night before.
You just have to drink a kind of saltwater solution that basically washes everything out so they can see.
Dr. Simmons got a clean bill of colon health.
Nothing dramatic on the way up.
And may not have to have another colonoscopy for a decade. Kimberly Moss, the 5 o'clock news.
Most Americans should have their first colonoscopy by the time they're 50. However, African Americans have a higher incidence of colon cancer and should be screened by the time they're 45. Now, if you have a family history of colon cancer, you will need to be screened earlier and more often. For more information on colon cancer, just head to our